Oh, this is not a silly question at all. This is a fantastic question. Thank you so much for the opportunity to talk about this. September is actually Animal Pain Awareness Month, so this is wonderful timing. So how our dogs feel in their body plays a huge role in their behavior. Up to 80% of behavior cases involve pain in the body, either directly or indirectly. And of the various types of pain, orthopedic is statistically the most likely, followed by GI issues. To follow that up with some more fascinating statistics, 20% of dogs over the age of 1 have arthritis. That's 1 in 5 dogs over the age of 1 year old. And 4 out of 5 dogs, 80% of dogs over the age of 8 have arthritis. So investigating how our dogs feel in their bodies is a vital part and a first step in any behavior work. This is especially true if your dog has had these behavior concerns since you brought them home or within a few months of bringing them home. Or if you are noticing a sudden onset of the behavior or a sudden increase in the intensity, frequency, or duration of these stress-related behaviors. Now, I want to address one piece of how this question is phrased. Maybe silly question, but how do I take my reactive dog to the vet to make sure pain is not causing the reactivity? So what we found is that pain often plays a role in behavior concerns, but it's not always the cause of the behavior concerns. Sometimes it is. Sometimes there is a direct connection. The dog has an earache, you touch their ear, they display aggressive behavior. You resolve the ear infection, the behavior concern goes away. But a lot of times, more often, there is an indirect connection between the pain and the behavior concern. For example, we could have a dog who has stranger danger, but one of the reasons that their stranger danger is so big is because they also have chronic pain. And so managing the pain may not take away the stranger danger concern, but it may lower the intensity of it. It may support the dog in better accessing coping skills when they feel better in their body. Options like flight instead of fight might feel a lot more accessible to the dog if they're feeling better in their body. And the threat of being handled or having someone in their space might decrease, making that stranger danger not quite as strong as it was before. Those are examples of pain indirectly impacting the behavior concern, the stranger danger in this case. Another example might be to look at a dog with an anxiety disorder and GI distress. We know so much now about the brain-gut connection. And so are the gut problems causing the anxiety disorder, or is the anxiety disorder causing the gut problems? Is there also a role here for genetics and learning history? But what we do know is that addressing the gut problems are only going to help. It may not cure the anxiety disorder, but it can play a big role in how the dog is able to cope with stress, the intensity of their stress response, their resilience to stress. When dogs have underlying unaddressed health issues, we often see more variability in their ups and downs. Behavior work is nonlinear, and one of those reasons can certainly be when we're managing chronic pain or chronic illness, can definitely contribute to that up and down. But when those chronic pain issues or chronic health issues are identified and managed and treated, we have a lot less of those downs in our ups and downs. The other part of phrasing that I want to talk about in this question is, so how do I take my reactive dog to the vet to make sure pain is not causing the reactivity? So the other piece is we can't make sure. We don't have a diagnostic for pain. And I think as humans, we put a lot more faith than we should into physical exams and blood work. I could share a million stories with you of dogs whose physical exams looked good and their blood work looked good, and upon further investigation, they had very serious health concerns. And so it's important to know that pain is not something that we can rule out. And just because we don't see evidence of pain on our first swipe or two of diagnostics and attempts to gather information does not mean that pain is not there. And we see this with humans too, where humans who are living with chronic illness and chronic pain and are able to communicate to other humans that they do not feel okay will often have their initial test results at the doctors come back fine. but that doesn't mean that something's not going on. Okay, so where do we start? Particularly with dogs who have behavior concerns that may make it difficult for them to be seen at the vet, or whose behavior or stress levels may otherwise influence the information we get from, say, a physical exam. So for some dogs, a physical exam with your veterinarian may be a good first step. But in order to get the best information from these types of exams, the dog is supposed to be relaxed, and many dogs are not relaxed at the vet, especially dogs who have behavior concerns. Most of my clients are on event medication at the vet, and that can certainly interrupt our data collection. Now, a vet exam is still a good place to start. Sometimes the pain we find is going to be glaringly obvious on an exam. But a vet I work with says that by the time we can see physical signs of pain or find pain on a physical exam, the dog is likely experiencing a 6 out of 10 or higher on the pain scale. And since I first heard that, I've taken that idea to several other vets that I know, and I've asked if they think that that's likely accurate. And they've said yes, 100% of them. And so while absolutely the first step should be talking to your veterinarian, and a physical exam would be a very normal course of action, it's definitely not the end of the road if your dog is not relaxed and comfortable enough at the vet, as most dogs are not, to get really clean, solid data from a physical exam. Your vet has other ways to gather information. When orthopedic pain is suspected, X-rays are often a recommended diagnostic tool. It's important to keep in mind, though, that imaging has its limitations as well. Just because your dog has clean X-rays doesn't mean they're not in pain. Another common option is a pain trial. Based on the information that you're bringing your vet about your dog's behavior and the information that they're able to gather, your vet might be able to make an educated guess about what type of pain your dog may be experiencing. And then they can have your dog trial the most appropriate pain medication. Good pain trials last several weeks, and you want to keep good data around your dog's behaviors. Is the quantity or quality of their sleep improved? Are there changes in the ways they play or eat or move or get on and off the furniture or in and out of the car? Are they more playful? Are they less playful? Do they have more energy or do they have less energy? Is the intensity, duration, or frequency of their stress responses decreased? Do you notice a difference in the way they're moving their bodies? Do they stretch out more to sleep versus be curled up in a tiny ball? And again, even if you notice no behavior change, that doesn't rule out pain. I had a client email me recently with a great thought. They said that they felt like giving a dog an anti-inflammatory and not seeing a difference and using that to leap to the conclusion that the dog was not in pain felt a lot like giving a human Tylenol and then assuming that the human was not in pain because we didn't see any overt behavior change. But pain trials can be incredibly helpful, because if we notice differences in the dog, then we can work our way backwards and say, okay, something is going on here, and this maybe gives us some information about what, and now we can proceed with additional diagnostics. Another really great and non-invasive option can be taking videos for your vet to review for the sake of gait analysis. So professionals trained in gait analysis can ask you to take videos of your dog moving at certain speeds, and they may have you film the video in slow motion, and they can analyze your dog's gait and get some really good information. Another option is something called a digitherm, and we recently got one of these here in Richmond, Virginia, and I believe the next closest one was previously a couple hours away. So very exciting to have it here. It's been very, very helpful. Our local veterinary behaviorist has one, and it looks like an iPad that takes pictures of the dog and shows the heat signature, so we can see where inflammation is and track down our arthritis or allergies. And it can be very helpful to go on this investigation with a vet who is educated in the connection between behavior and pain. This could be a veterinary behaviorist, sports medicine vets, physical therapists, vets who specialize in pain management, vets who specialize in working with senior dogs, although not all pain happens in senior dogs. Working with someone who enjoys digging into that type of work can be really helpful.